you are writing your nursing notes or taking in information about your patient, regardless if you're in the Vineyard View or the Mountain View or the ER view or the ICU or whatever, wherever you are, you're dealing with your patients and you're responsible for the care of that patient. You got a lot of information on that patient perhaps. You need to do vital signs. And how do you go about getting your vital signs? How do you do it? Anybody remember how to do vital signs? How do you do them? Dynamap? Pneumatic? Because I don't have time to actually do an auscultated blood pressure. I don't have time to actually feel your pulse. So when you do the Dynamap, and I'm not being terribly, I'm not trying to be anti-Dynamap. I think it's great for convenience. But quality, it doesn't give you that. In fact, it can give you, the Dynamap says the heart rate's 86, and that's what you write. But did it say 86 in irregular? Probably not. Did it say 86 with weak response, or bounding, or thready? These are terms that you would throw in your reports. But your Dynamaps, when we get comfortable with using machines, we tend to give up our practical way of doing things. Now that becomes the practical way. That's the new norm. But talking to somebody, if I walk up to you, what's your name again if you don't? Romina. I'm your patient. May I never be your patient or anybody's patient, but it's going to happen. I come in, I have a complaint. I say, are you the nurse? Or you and I figured it all out. Yeah. You go, yeah, have a seat. What's wrong? I don't know. I don't feel good. What could you do right then and there besides tell me to have a seat? Feel my pulse. That's going to tell you a lot. It's going to tell you that they have one. You know he does. Right? But what's the quality of that? Well, wait, where's that Dynamap? I'm using it. I'll be with you in a minute. Okay, we got to wait for that. If I'm just saying if that were to happen. But you could reach over and feel my pulse and realize that, hey, this guy's pulse is really irregular and really weak. I could barely feel it. That might give you a sense of urgency here. Hey, you know what? Let's get you in the back because he's looking a little pale. He doesn't feel good. He's an older guy. Good looking, but he's an older guy. Okay? You want to get him in the back rather than waiting in the waiting room. Feeling pulses. So what does that have to do with this? Well, again, you can count pulses, but it doesn't give you quality here. We don't look at an ECG by itself and say, well, that's their problem. No, it's just a tool to gather information with everything else. There may not be anything wrong with the heart. It could be something outside the heart that's causing the irregularities. Remember I told you about the motor mounts? Things that are moving about and this, that, and the other? Okay? All right. Do you guys use this one? Have you ever figured that out? Now again, I understand you're using Dynamap, and if you're taking people's pulses, actually feeling pulses, good for you. Keep doing that. But when you're doing a recording from the Dynamap and you're writing in there from the Dynamap, you don't usually put in there that it came from the Dynamap. The supervisor or whomever, I was a paramedic supervisor in the fire department on my shift, so I have to review the medics' PCRs or pre-hospital care reports. So we get copies of them. Hospital gets it for the patient. One goes to the county and we have a copy, and I have to review that to see that my medics are filling in the blanks, doing what they're supposed to do. That's my job, part of my job. So when I see something like when they take their vital signs, I didn't ask them how they took it because we had the pneumatic devices as well. But I'm hoping my medics are good enough to actually feel for pulses. They may not have said that in the report, but it's taken for granted. But I want to be able to tell you this, that when someone asks you, how did you take the blood pressure? Well, I used a Dynamap. Okay, great. What was their heart rate? Oh, it said it was 86. Okay, what was the quality of that? Well, what do you mean the quality? It was regular. No, I mean the quality, not the rate. What was the quality of that? Well, I don't know, because the Dynamap doesn't give you. I want to trust but verify. Trust your machines, but verify it. Because sometimes your machines, a 0 to 40% chance that they're incorrect. 0 to 40% chance. So that means somewhere along the line, something's going to be off. Verify. Verify.